Dear students, welcome back. In the previous session, we have discussed about motions of the patella. Now, in this session, we are going to discuss about patellofemoral joint stress and also patellofemoral joint reactions. Okay. So, the patellofemoral joint can undergo very high stresses during typical activities of daily living. The joint stress means the force per unit area can be influenced by altering either joint forces and joint surface contact area. So this joint stress can be influenced by two factors. One is altering either joint forces, or joint surfaces contact areas. So based upon these two factors, this patellofemoral joint stresses are influenced. Okay, the patellofemoral joint reaction force is influenced by, now comes the patellofemoral joint reaction force. Here the reaction force means definitely contact force. So when there is a contact only, you will get the reaction force, isn't it? So the patellofemoral joint reaction force is influenced by both the force generated by the quadriceps tendon or quadriceps and the knee angle. So these are the two things which influence the patellofemoral joint reaction force. Okay, so one is patellofemoral joint stress, which is influenced by either altering the joint forces or joint surface contact area, and this patellofemoral joint reaction force is influenced by both the force generated by the quadriceps muscle as well as the knee angle. Okay, yes, as the knee flexes and extends, okay, what will happen? As the knee flexes and extends, the patella is pulled superiorly by the quadriceps tendon, with the pull resisted inferiorly by the patellar tendon. Okay, so that means during flexion and extension of the knee, there is pulling of patella superiorly, and this one is resisted by the patellar tendon. Okay. Next, the combination of these pulls produces a posterior compressive force. So here you can see this is the quadriceps force and this one is the patellar tendon force. You can observe here these two are acting on a single point. So that means what is the type of force is creating here? It is a concurrent forces acting at two different directions, which produces a posterior compressive force. Okay, posterior compressive force of the patella on the femur. Patella on the femur that varies with the amount of knee flexion. So that means these two forces acting on patella, which creates posterior compressive force. That means the patella is going to attach or compress or contact with that of the femur, which varies the amount of knee flexion. So some degrees of knee flexion only this patella is going to attach with the femur, isn't it? So during complete flexion, what will happen? The patella is going to sit into intercondylar notch. That thing you people know. And as the flexion, from flexion to extension, it is coming out of this intercondylar notch, and during maximum extension, what is going to happen? The patella is not touching the femur, isn't it, during full extension. Okay, because of these two forces, that is force of quadriceps as well as the patellar tendon. Okay, so that is the thing happening in the patellofemoral joint stress. Now we will see in detail about this thing. Okay, now at full extension, okay, at full extension, the quadriceps posterior compressive force on the patella is minimized. Why it is going to minimize here? Due to due to unaccompanied origins of this vastus medialis and the vastus lateralis muscles on the posterior femur. Okay, so in spite of the small contact area that the patella has with the femur in full extension, the minimal posterior compressive force of the vastus lateralis and vastus medialis muscle maintains lowest joint stress at full extension. Okay, so these are the pulls of this vastus medialis and vastus lateralis, which decreases the joint stress, at full extension. Okay, so this is the reason why some of the exercises are designed in improving quadricep muscle strength is straight leg raising. That means without flexing of the knee, there is an quadriceps exercises, that is straight leg raising, which is decreasing the compressive forces on the patellofemoral joint, and during the straight leg raising, which creates decreasing the compressive forces, therefore decreasing the patellofemoral pain, because there is no contact between these two bones, and definitely there is a reduction of frictional forces and there is a reduction of wear and tear also. So in this position, the quadriceps exercises are designed. Okay, yes. As the knee flexion progresses from full extension, the angle of pull between the quadriceps tendon and the patellar tendon decreases. So normally in the straight leg raising, what is the angle? This angle is more. When the person is starting flexion, so that means what is happening to the angle? From extension to flexion, what is happening here? So the knee angle is going to decrease. Okay, so that means what happen? If the knee angle is going to decrease, so the joint reaction force is going to increase, and what is going to happen if joint reaction force increases? Then which increases the what? Compressive forces. So which increases the compressive forces. Okay, this increased compression occurs whether the muscle is active or passive. Okay, so if the quadricep muscle is inactive, then the elastic tension also increases with increased joint knee flexion. So what will happen here? If the quadriceps muscle is not working, still what is going to happen? The elastic properties of the tendon, so that means this point is going to stretch. Okay, so that means the quadriceps tendon is going to stretch. So this one is also creating the joint increase the joint reaction force, because the knee joint angle is going to increase, isn't it? Yes. Next, if the quadriceps muscle is active, then what happens? Then both the active tension and passive elastic tension will contribute to increasing the joint compressive force. So if the muscle is also active, then what will happen? So the contracting force of the quadriceps plus and the elastic tension in the tendon, both the things are going to add up along with this opposite force, that is patellar tendon force. Okay, all constitute together to increase the joint compressive force. Okay, so therefore the total joint reaction force is influenced by the magnitude of active and passive pull of the quadriceps as well as by the angle of knee flexion. Okay, yes. Now we will see when at what are the activities which we done routine in a daily basis. So what are the activities which increases the patellofemoral joint reaction forces? Now we will see. So the patellar joint reaction forces can become very high during our routine daily activities, like during the stance phase of walking. Okay, during the stance phase of walking, when peak knee flexion is only approximately 20 degrees. So then the patellofemoral compressive force is approximately 25% to 50% of the body weight. Okay, so when there is 20 degrees of knee flexion, what is the compressive force means? It is about 25 to 50% of our body weight. Okay, with greater knee flexion and greater quadriceps activity as during running. Okay, so then what happens? So definitely what is going to happen with greater knee flexion means greater angulation, angle of knee. That means greater knee flexion means what is going to angle? So the angle is going to decrease here. So then greater quadriceps activity. So more contraction of quadriceps, okay, which includes both the elastic tension and the quadriceps action. Both the things are going to add up during running. Then what happens? The patellofemoral compressive forces is still high. So how much means? It has been estimated to reach between 5 to 6 times of the body weight. Just imagine that. So if your weight is 50 kgs, 5 times means how much? 250 kgs. Okay, is how much joint compressive forces are acting here. Okay, deep knee flexion exercises. Deep knee flexion, that means almost all full range of knee flexion exercise that requires large magnitudes of quadriceps activities can increase the compressive force still further. So although reaction forces or other lower extremity joints may reach these same magnitudes, they do so over much congruent joints, that is the compressive forces are distributed over large areas. Okay, if you see at the normal patellofemoral joint, the medial facet bears the majority of the compressive force. So why? Because if you see in full flex, in the previous session we have seen during knee flexion, isn't it, from extension to knee flexion, we have observed the contact areas of the patella, isn't it, which is going to increasing the contact areas of the patella on the femur at the middle of the knee flexion, that is 45 to 60 degrees. It is having maximum contact force, isn't it? And after full flexion, what is going to happen? Only the medial aspect, that is the odd facets of the patella, is going to contact with that of the femur, isn't it? So now we will see what is going to happen during these various kinds of contact forces, how these compressive forces are going to change. Now we will see. At the normal patellofemoral joint, the medial facet bears the majority of the compressive force, and several mechanisms are going to help to minimize, okay, or we can call it as minimize, or such kind of thing has to be disappear, okay, for the patellofemoral joint stress on the patella in general, and on the medial facet is particular. So some of the several mechanisms help to minimize or going to stop or going to disappear such forces on the patellofemoral joint, especially on the medial facet. Now we will see what are those things. In full extension, there is minimal compressive force on the patella, as you know that. Therefore, no compensatory mechanisms are necessary. As knee joint flexion proceeds, okay, as the knee joint flexion proceeds, the area of patellar contact gradually increases, isn't it? So then what happened? Dispersing the increased compressive force. As the contact force increases, compressive force is also increases. The simultaneous increase in contact area and compressive force helps to minimize patellofemoral joint stress until approximately 90 degrees of flexion. Okay, especially from 30 degrees to 70 degrees of flexion, the magnitude of contact force is higher at the thick cartilage of the medial facet near the central ridge. And the articular cartilage is among the thickest hyaline cartilage in the human body. The presence of this thick cartilage is better able to withstand the substantial compressive forces transmitted across the medial facet of the patella. Within this some range of motion, the patella has its greatest effect as a pulley, maximizing the momentum of the quadriceps. With a larger momentum, less quadricep muscle force is needed to produce the same torque, minimizing patellofemoral joint compression. As flexion proceeds, the momentum diminishes, which necessitates an increase in force production by the quadriceps. As knee flexion continues beyond 90 degrees, patellofemoral stress will increase as the patellar contact area once again diminishes. So the quadriceps tendon now contacts the femoral condyles, however, which helps to disappear some of the increasing compressive forces on the patella. So these are the things which are going to take place during different degrees of knee flexion. And if you see, the vertical position of the patella can also significantly influence patellofemoral stress. So some of the studies done by Singerman and colleagues demonstrated that in the presence of patella alta, that means the patella sits above normal, okay, then what will happen? The onset of contact between the quadriceps tendon and femoral condyles is going to delayed, isn't it? Yes. As flexion increases, patellofemoral compressive forces will therefore continue to rise. In contrast to the patella alta, so then what happens? The patella can also sit lower than normal. So opposite to the patella alta, so now the patella is going to sit below normal. Then what will happen? If the patella is positioned more inferiorly, it is termed as patella baja, and may be due to shortened patellar tendon, and this is due to shortened here the patellar tendon is short, then it is going to sit inferiorly. So with patella baja, the contact between the quadriceps tendon and the femoral condyles occur earlier in the range. So the contact between the tendon and the femoral condyles contact will occur earlier in the range, resulting in the concomitant reduction in the magnitude of the patellofemoral contact force. So these are the things which are going to happen in the patellofemoral joint stress. In the next session, we are going to discuss about frontal plane patellofemoral joint stability. Thank you.